Good evening, everyone, and welcome to yet another interesting and informative session on Wesley Guild SA. As we all know, this month marks a very important and significant month in South Africa. It is Women's Month. And our conversation today is a very important and necessary conversation to have surrounding women. Talking to us today is Dr. Noluyolo, who is a gynecologist and fertility specialist. And she will be unpacking the topic for us more, which is understanding the woman's cycle from birth to death. Before we can start, I would like to ask Oreb Nombo to just open for us in prayer.
Let us pray. Egameni loyisene lonyana nelomoya ongcwele yisewe Nkosi yethu enguYesu Kristu, mdali wezulu nomhlaba, ungumthandi wenkoliswano, ubomi bethu Nkosi bubakho ngenxa yokwazi wena. You God, you are the Alpha and you are the Omega. Everything, Lord, begins with you. Everything, Lord, is in you. And Lord, even after the end of times, you will be still God. Ilondo somandla sisondela kuwe emveni kwemini ngolwesibini. Siphakamisela kuwe Nkosi udumo namandla ubukhosi nobungcwalisa. Sisithi Nkosi uThixo njengawe sikakamboni. Soze abe khona nanini na ngalomhla Nkosi we-11 ka-August. Sisatsho Nkosi sisathi igama lakho limele Nkosi kubongwe endaweni zonke. Libongwe ngabantu, libongwe zingelosi. Ngoba likho igama elihle njengelakho. Ngena nathi ke somandla as once more we gather in this platform with young people in an opportunity, Lord, of learning, empowering our youth in the Methodist Church and all of us, God, who are listening to this program. Here we are, God, with your servant, uYoli Moya Ongcwele, who will lead us in this conversation. Thandazela Nkosi presence yakho in these airwaves. Thandazela Nkosi ukuba Nkosi into ezomthetho apha kube khona umuntu ozidakala athi Nkosi kala program yolutsha ndandinengxaki ndangidakala. Sigcine ke Nkosi silondoloze, sikhusele Nkosi phakathi kwengozi nentshaba, sibe ngabantu bakho benguThixo wethu. Hlala nathi ke Nkosi ubeni kobumini namhlanje. Senzele zonke Nkosi izinto esiziceleyo nesingazicelanga ngelo gama lakho elinamandla leNkosi yethu uYesu Kristu. Amen.
Amen. As I hand over to Dr. Singcu, I would like to remind everyone that this is a conversation that is rather interactive, So if anyone has comments, questions, or anything they would like to say, feel free to leave it on the comments section and we will address it to Udok and get the answers that you require. So yeah, sit back, enjoy, comment, interact, and let's all learn something from this. Over to you, Doc.
Okay, thank you so much, Palisa. Just a little bit of correction. It's Noluyolo. Uvuyo, Uyolo. It might be one and the same thing, but my name is Noluyolo. Singcu. That's fine, dear. I get that all the time. All right. Today, I just felt like, okay, let's talk about the women's cycle from puberty up to menopause. All right. So the stages of a woman. So I will start with the little girl. I'm gonna mix. I'm not sure which language should I be using, but if you know East Xhosa some becomes too deep, let me know. But let's talk about the young girl. Now, as a young girl, what are the stages of development that a girl should expect? Now, it starts with the breast development, followed by a little bit of development of hair in the armpits and in the private parts. And as time goes on, the girl will start having periods. And just before the periods, they will grow a little bit taller, which we call the growth spurts for girls. Now, at what age should these things be happening? From the age of about 7, if you're looking at a young girl now, the breast will start developing. And then at the age of 9, that means girls now can start from the age of 9 years to experience a period abo, It's no longer 12 years as we used to think when we were growing up, but now young girls from the age of 9 can start having their periods. And then the breast continues to grow and genzeka. Now, there's something that we need to look at because not all young girls develop the same. As a mother or as a sister or as a young girl who's listening today, you might ask yourself, when should I start being concerned? If you don't develop breast or you don't start menstruating by the age of 9, there is nothing wrong with you, but you need to wait until the age of 14. If by the age of 14, you don't have breast, you don't have pubic hair, then you should be examined so that we can see what's going on. But if you have pubic hair, you have breast, and you still haven't menstruated by the age of 16, you need to be investigated. All right. Balisa, are we still on? Are you still following me?
Yes, I am.
Okay, we are clear. The
Definitely.
key ages, the key ages, it's 9, they can start menstruating now. If they have been started menstruating and they don't have breast by the age of 14, then the young girls needs to seek medical advice. By 16, if they have breast, but they haven't started menstruating, then they need to seek medical advice. Now, there is something that we need to be on the lookout for. When we're talking about the stages, I mentioned something like a growth spurt. That means whereby a girl starts developing some height. Now, if a girl is short, that is another sign that we need to look out on the young girls. If they are shorter than their peers and they don't get their periods as well, then they also need to be helped. Especially with them, you might notice that their chests are just flat. There's not even a small sign of a breast that's developing. Okay. I will leave it there with the teenage girl. Now, the teenage girl, there are other issues that they are faced with. The periods have come, but the periods are painful, all right? You might expect that the periods will not be that painful within the first 2 to 3 months of them coming. But some of them, when they start to feel like then their periods become painful. And others, it might take time. So the pains of a period, they can either start 2 to 3 days prior to having your periods, or you just have a funny feeling in the abdomen. It feels like something is pulling on you, and then it's not severe cramps, and sometimes they are accompanied with backache. And then they start having their periods. The periods might be heavy, or the flow might just be normal. Now, talking about heavy period, what do I mean by that? If a girl finds that they need to change a pad every 2 hours, and when they change that pad, the pad is soaked, that is a heavy period. Or if sometimes when they wake up, they've soiled themselves, that means those periods are heavy, right? Then they will need help with it as well. All right, can I pause there, or can I leave the teenage girl there? Because most of the time, it's usually the heavy periods. I'm not going to talk about the pimples that they get, because some of them, the pimples are periodical. We take it to be accompanied, or we normally call it the stage. But now there comes a time in their life whereby the pimples are too heavy for them. All right, we will talk later about that. Now, if we're looking at, now let's talk to Osisana. Let's come to the reproductive years. what are the things as women are growing up that they should expect. Now, when it comes to the reproductive years, from about 16 onwards, and then when people start having children, up to the time whereby the periods stop. So that lifespan will take it from 16 years up to about 49 years for some people. It can be up to 50, all right? Now, with the reproductive years, what are the changes that are happening with women, all right? Women will start gaining weight, some of them, and what they need to worry more about is, these young girls, is where they gain the weight. There are different shapes that women tend to be categorized into. You've got the pear, you've got the apple, all right? The pear are the ones that are said to be smaller, and then they have their hips. And then the apple are the ones that tend to have bigger abdomens. So meaning that if figures are slightly out of shape, then we need to watch out for those women whereby their figures are slightly out of shape, because that is usually accompanied by some of the hormonal problems. All right. Now, with those women that tend to be bigger around the waist, what they need to be on the lookout for, they need to check if their skin is oily, right? They need to check if they've started developing some hair on their faces. They need to check if they've got acne that is out of control. And they also need to watch if their periods are happening every month. A period is supposed to happen every month, but it doesn't necessarily have to happen at the same time every month. As long as when you calculate that you have your period every 24 to 35 days, that is absolutely normal. But now these women that tend to be bigger around the waist, sometimes they will have a period and they will skip 2 to 3 months without seeing their period. Some of them will have a period twice a year. All right. It's not a problem when you're not wanting to have children, but you need to know what is the problem. And some of this problem can be tackled earlier on than later. Now, the most common condition that tends to affect this teenage girl, it's something called polycystic ovarian syndrome. All right. So it's poly, meaning many, cystic, many cysts in the ovaries. That will be a diagnosis that will be made when you go and see a doctor who will do an ultrasound and they can pick up those smaller cysts. Now, we usually say it's like having freckles on your face. Those cysts on the ovaries, it's not the cysts that need to be operated and be removed. But what they tend to do, they tend to produce hormones, which make you have oily skin, which can make you develop hair. Like you can develop a little bit of a mustache. You can find yourself that you're having hair on your chest. You start developing hair like the men will do, whereas you're a girl. That needs to be watched out and be sorted out. Then your periods start going away. All right. Now, the other common condition that young girls will experience, or women of the reproductive age will experience, it's something called endometriosis. Now, with endometriosis, when a woman has periods, the periods, it comes out as blood and it's seen as blood, but sometimes that period doesn't come out of the vagina, all of it. What would happen is it flows back through the tubes, what we call the fallopian tubes, back into inside of the pelvis, right? And when it sticks there, it causes pain. Now, that pain, initially, it will be bearable, but as time develops, the pain becomes unbearable. They have painful menstruation, and at times they will have pains when they even passing number 2, when that endometriosis is severe. All right. Now, when you have endometriosis, We often say, especially if it starts quite early, we don't like operating on the young girls. So we would advise putting them on hormonal treatment, which can actually help relieve the pain. But as time goes by, if they actually develop cysts, which are painful cysts, or sometimes we call them chocolate cysts, because what happens is you've got cysts which have a collection of old blood, so which is what we call endometriosis, and they can be very painful. Having endometriosis can actually affect your chances of having a baby later on. So the quicker your endometriosis is kept under control earlier, it's much better for you. Now, the other thing that can affect women of reproductive age is the fibroids. All right. Fibroids are very common with the African culture, and we often do not know what causes them. But fibroids tend to be associated with not having children. If you haven't had children early, or you have your children early and then you start developing fibroids later on in life. Fibroids are not cancerous. They are growth in the womb, but they are not cancerous. We're still together, Palisa, you following me?
Yes, Doctor, I am.
Okay, if I become too technical, please tell me.
All right. I will. I'm jotting things down. So no, we're still together.
Okay, sure.
Yes.
Now, when it comes to fibroids, the fibroids, they are growth on the womb itself. They are not cancers. The size of the fibroid sometimes can be as big as a woman who is like 9 months pregnant. So that's something that we need to be on the lookout for. They are not painful, but what they tend to do, they will cause heavy periods. Your periods, you will bleed a lot and you will bleed for a longer time. And they will cause you to have miscarriages when you start having children. Or for some people, they might find it difficult to even conceive because of the fibroids. And if you develop fibroids later on in life, let's say in your 50s and in your 60s, those fibroids are likely to become cancerous. But in your earlier years, the fibroids are not cancer. All right. Then when you have fibroids, there are various ways whereby these fibroids can be managed. But if you still want to have children, the best thing is for the fibroids to be removed, because fibroids, they can actually lead to a miscarriage, and as I have said, or they will make the baby come out prematurely. All right. So removing the fibroids is the best way of managing them. But if you've had your children and you don't want to have fibroids removed, there are other ways of managing fibroids, which we'll talk about at a later stage when we're talking about the age group from 45 onwards. Right. Now, when it comes to the reproductive age group, the other thing that these people are faced with, or these young women are faced with, are the choices to use for contraception. Yes, this is a church talk, but we've got married people that would like to know what birth controls to use, what works best, and what are the side effects of each. So if I can just touch a little bit on that, on the birth controls. Now, when we're talking about birth controls, you're looking at different types. You've got types that you can take every day, that is the pills. And you've got types that you can take weekly, that will be your patches. And you've got injections, which you take every 2 to 3 months. And you've got contraceptive devices that are inserted and they stay there. You don't need to check on them until maybe 3 months, or 3 years, sorry, or 5 years. Now, let me start about talking about the birth Are you still with me?
Yes, I'm still with you.
Sorry, my phone just disturbed me. All right. So when it comes to the birth control pill, there are two types. We've got a pill that contains the two hormones, that is the estrogen and the progesterone. And we've got the pill that contains only the progesterone. Now, people that have got other conditions like heart problems, that are diabetic, we don't usually advise them to use the pill that contains both hormones. However, they can use the pill that contains only one hormone, which is the progesterone. Now, if we're looking at the progesterone, the what's available in the market, its other name is micropill or micro-over. So when you're taking the micropill, what happens is you need to take it at the same time every day. And if you get sick and you take any other medication, you need to take extra precaution because the pill might not work. When it comes to the progesterone only pill, what happens with it as well is that you tend to have spotting, erratic bleeding that might happen. When it comes to the combined pill, there are many that are available in the market. It depends on the amount of estrogen and progesterone that's on the pill. But the lower the doses of each of the hormones, the better it is for you. Now, when it comes to the combined pill, their problem is that they tend to have clotting. You know, you can develop blood clots on the legs, which can actually even affect your heart. So you need to be careful when you're taking the combined pills as well. That is one of the reasons why we won't give them in people that have got heart disease, in people that have got diabetes as well, because the risk of clotting is even higher with those people. Then when it comes to the injections, you've got the 2 months injection and the 3 months injection. The injection, you tend to use it when you want to make sure that you space your children. Now, when you're spacing your children, with the injections, you know that once you've stopped taking the injection, it might actually take you a year for fertility to return, all right? And then what are the side effects that you can expect with the injection? Some people, though it's not a side effect to them, it's a welcome side effect, they tend not to get their periods, which is fine, for as long as you know that you've been getting your injections at the correct time. When you don't see your period, you don't need to panic. That's what happens with the injection. But some people will get their periods, and you get a minority of women that will tend to have heavy bleeding when they are on the injections. They will have erratic bleeding, whereby some will spot, some will bleed for 2 weeks, some they can bleed for longer. And if whatever treatment you're being given to try and help that, it's not working, then it means the injections are not for you. You don't need to use them. You need to change to another form of contraceptive. Now, there is what is called the implant. The implant, it's when a small device is inserted in the upper arm. That can be done in the clinic. It's inserted in the upper arm and the device stays in for 3 years. You can take it out after 3 years and then you will start having, your periods will become normal again, and you can even fall pregnant immediately after taking out. But the problems with the device is that it causes bleeding as well. Some people complain about spotting for up to 6 months. Some people will not know when to expect the periods because they will be thinking they are in a period and the next thing it stops and then it comes again. So bleeding problems is one of the side effects that are associated with the implant. And the headaches, that's another common side effects with them. If the side effects last for more than 6 months, then we usually advise that the implant, it's not for you. Maybe you need to change it and use something else. Now, the loop. Yes, the loop. The nice thing about the loop, you don't need to remember. It's inserted. Once it's inserted, it can stay up to 5 years. And then you can only take it out after 5 years. Now, the downside of the loop is that you might fall pregnant. And most of the time you fall pregnant with the loop in, you tend to get an ectopic pregnancy. That means the pregnancy lies in the tube. The loop is inserted and it lies in the womb. When the loop is in the womb, it makes the environment within the womb to be hostile. It makes the sperm to not move as fast as it should be moving to meet an egg. And then it also makes the lining of the womb to be thin, which is why if a pregnancy happens, 9 out of 10, it's in the tube, which is what we call an ectopic pregnancy. However, there are few instances whereby the loop will perforate. That means it will go into the womb and pass through the womb. And then when that happens, a woman might think that she's got the loop in the correct place, but she will end up falling pregnant. Or some of them, they will start having pains. When you have pains after you've inserted the loop, please make sure that you go in so that it can be checked if it's in the right place. All right. Oh, the patch. I didn't mention the patch as a form of contraceptive. The patch, it's something that you can stick onto your skin anywhere from the waist downwards. The patch, it's a combination of progesterone and estrogen, and you attach it weekly, and then for 3 weeks you leave 1 week free, and then after that 1 week which is free, you can expect to get your periods, and then you restart again. All right, so I think I will stop there with the contraceptive. And just to add on, it's always advisable with whatever form of contraceptive that you are using, the condoms is still necessary. What the condoms will do will protect you from getting any sort of infections that you might get. And the big one being the HIV. Okay. We're still together?
We're still together, Doc.
Okay, all right. Now, I want to talk about having children and all those things because that's a topic on its own. Now, the other common problem that people tend to, or which is something that we see more and more often. Remember, I said a woman will start menstruating at about the age of 9 and can go on up to about 49, 50. But we do have women that will stop their periods before the age of 40. When a woman stops having period before the age of 40, that is, they stop on their own without having gone through the operation, without having gone through any illnesses, they need to see a doctor because it might actually be a problem. So we do have women that we call it premature ovarian insufficiency or premature ovarian failure. That means the ovaries, they fail, they stop working. All right. Now, the main thing that affects women in the reproductive area, which is what drew me as a gynae, is the problem of infertility. Right? Just to brief people about infertility, is to say that most of the time, infertility is taken as a woman's problem, whereas it's not a woman's problem, it's a couple's problem. Both the woman and the man usually have a problem. But just to mention briefly, what are the problems that we encounter as the cause of infertility? If we're looking at a woman, it's usually the tubes. There might be infection, there might be endometriosis, which can affect the tubes, which can lead to infertility. And then sometimes, remember those women I talked about, the apple-shaped women, they tend to have hormonal problems. Sometimes the problem is not within the pelvis, but the problem, it can be your thyroid gland, or it can be something in the brain that is not working properly. Some women will start producing milk, whereas they're not breastfeeding. So if that happens, it means there's a tumor that's in the brain that actually, it affects your periods, and then it will affect you falling pregnant. So that's something that can be corrected. And then sometimes, and it happens to be, most of the time we look for the cause of infertility and we cannot find it. That is from the woman's side. And then men can also have an infertility problem, whereby the sperm is not being formed properly, or they've had trauma, or they've had mumps in childhood, which tends to affect the seed or the formation of the sperm in the man. So what we are realizing now is that out of 100 couples that come with infertility, 50% of them have got both a male and a female problem. And then 33% of them, it's usually just a female problem. And the other, about 30 to 40%, it's also a male issue alone. So if you're looking at it, it means that both parties are now affected. Now, what contributes, or what we seem to know to be contributing to the male problems? One is the diet that we eat. Two, the environmental factors, or the type of jobs that they do. People that work with paints, people that work with pesticides, people that are into agriculture, they will inhale those fumes of pesticides that can affect the formation of the sperm. And then the other problem that we've seen with male as well is the use of our drugs, which tend to affect the sperm itself. All right. So that is the other problem. Now, going back to women, there is something that we are seeing now. More and more women are getting married late in life. Women are delaying having children. And when they start wanting to have children, it's actually too late. Now, there are things that can be done to make sure that a woman can save their eggs. Unlike the men, the women's egg lifespan, it lasts till about 35. After the age of 35, there's a drop in how the eggs function. So women need to, if you see that you are approaching 35 and you're not planning to get married anytime sooner, or you're still pursuing your career, there is what we call egg freezing. All right. You can freeze the eggs, and at the same time, having children, we now say that you can have children as a woman up to the age of 50. There is always a help that can be done for you. Okay. Are we together?
Okay. Yes, we're still together.
Sure. Now, let's talk about the mature women now. What are the problems that they experience? Okay. We might find that when we're talking about the mature women, the things that they tend to experience will be irregularities with their menses. all right? Some of them, we can see that menstruation tends to be a problem throughout a woman's life. Women from the age of 45, what tends to affect them is that they can have irregular menses. What do I mean by irregular menses? They can bleed twice a month. They can have spotting, all right? Spotting, it's when you always have a drop of blood. You might notice that when you're wiping yourself. You might notice that you always need to have a panty liner, and in your panty liner, there will be, it's like you're finishing your menstruation. And then some women tend to have heavy bleeding. The ones that tend to have heavy bleeding are usually associated with fibroids, because fibroids tend to be much more common in this age group, because some of them have had children much earlier, and then because of the hormonal drive, fibroids develop. Some of them have never had children, and this will be the time that they will notice that they've got fibroids. And then they start having problems with weight gain, right? When we're having problems with weight gain, sometimes it's because of the change in lifestyle, but sometimes it's because of hormonal issues, especially the thyroid. We tend to undermine the thyroid, whereas the thyroid does affect quite a lot of people. The thyroid becomes underactive in a lot of women than we think. Some of them, it's subclinical, but in some women, they can actually have signs of it. When you have signs of an underactive thyroid, you tend to feel cold when everyone else is feeling warm. And you tend to notice that you are gaining weight, but your diet hasn't changed. If you're a sporty woman, you're still exercising as you used to, but you are now picking up weight. And then the other problem will be your sleep patterns. The sleep patterns become affected. You might sleep earlier, you get drowsy, but you wake up in the middle of the night and you find it difficult to sleep. But now, usually with that, when we're talking about sleep being disturbed, there's a period called perimenopausal. You are not yet menopause, but you are knocking onto the menopause. So you find that you sleep, but you struggle sometimes to sleep, or you sleep and then you wake up in the middle of the night, you battle falling back to sleep. And then usually around this time as well, this is the time whereby you find that your desire for the husband, for those that are married, has sort of waned down. That is also tied to the hormones. Yes, there are other things that can affect that. That includes the stress, that includes other illnesses that a woman must be having, which is why we often encourage women, once you get to your 40s, even though when you were in your 30s, you didn't frequent doctors, in your 40s, you must make sure that at least once a year you go and see a doctor, so that you are checked without having to go because you are sick. All right. Then one other thing that women need from the age of 30 is to be screened for pap smear. The reason why I'm saying from the age of 30, I'm using 30 because that's what the guidelines, the South African guidelines used to say. From the age of 30, you need to go and be screened. You get a free pap smear if you go to the public sector. But ideally, any woman who has been sexually active needs to be screened for cervical cancer. So any woman who's been sexually active needs to have pap smear regardless of the age. And when it comes to pap smears, if you have been diagnosed with HIV, then you also need to have routine pap smears done for you. The reason being that when you are HIV, the progression of cancer, if you do develop cancer, it's very fast compared to someone who is not HIV, which is why we emphasize you to be screened much more frequently. And then here comes menopause. All right. When it comes to menopause, it's when a woman ceases to have her menses. It's when a woman, we know that their eggs are not functioning anymore. Their eggs are more or less finished. They will stop having their periods. They will start having other problems, like they might find that they cannot control their bladder. All right. When they need to go and pass urine, they have to go now, or else the urine will start dribbling out. Then they start sweating. All right. And then this is when other conditions start in. You might find that you start having things like diabetes, you start having things like hypertension. But I will not dwell more on the diabetes and the hypertension. I will just be broadly what women should expect. And then the one other common thing that women experience at this time, it's dryness when they have to go, in the bedroom. Then they will experience pains there. That's because their hormone levels have gone down. Now, there are things that can be done to help those women. They can have lubricants or they can have hormone boosters, depending on where they are in their life. All right. Do I still go on, or we can pause there now?
I've got a couple of questions, Doc. So I don't know if you want to carry on and then we can recap with the questions.
I think let's tackle the questions now, Palisa.
Okay. One of the questions I have is surrounding fibroids, right? Someone says that with fibroids, they experience waist pain, insomnia, and they've also realized that their waist is getting bigger. So around the waistline is getting bigger. She has been diagnosed with fibroids, and the options that you mentioned were also given to her. So now what she wants to know is, what is then the interim solution for these problems that she's currently experiencing before she goes on to this procedure of removing the womb?
Okay. Now, when you've got, we often say that fibroids on their own are not painful, but you can get what we call pressure symptoms. Pressure symptoms, it means the fibroids are pressing on.
Your sound has disconnected.
Can you hear me? Okay.
Yes.
Okay. So I was saying that the one common symptom of fibroids besides the bleeding is what we call pressure symptoms, all right? What it means is that this enlarged womb is pressing onto the nearby organs. So the two organs that usually get affected with that will be your bladder and the rectum. What tends to happen is that they will have urinary frequency. What I mean by that is they will want to go to the bathroom more often because of the fibroids pressing on them, and they will discover that they become constipated. Now, with constipation, it can be because of fibroids, and at the same time, it can be because when you bleed a lot, the doctor will prescribe medication to boost your iron levels, which can also lead to constipation, but that will be the problem. Now, backache, sometimes it's mainly positional, all right? So now, you take painkillers, they're not going to solve the problem. And we often say that when you've got fibroids, it's best to avoid taking the contraceptive pills. The reason why we say avoid taking the contraceptive pills, the fibroids are estrogen driven. So if you take the contraceptive pill, you are also potentiating the growth of the fibroids. Okay. Now, if a woman is not ready to remove the womb, what she can do is there is something called a uterine artery embolization. So what they do is you go to, as if you're going for an X-ray, all right? So it's done by the X-ray people, by the radiologist. So they will inject something into the blood vessels leading to the uterus. And then they occlude those blood vessels so that they don't feed blood into the fibroids. In that way, the fibroids will shrink over time. So this process can be successful for some people, and then they don't need to do any other thing. But for some other people, this process, it makes them to have pain. Okay, so if she's done with having children, I mean, we usually say, and she doesn't want to have surgery, then uterine artery embolization is an option for her. Okay, yes.
All right. And then for someone who is younger and might be experiencing fibroids, does removing the fibroids, because I remember earlier you mentioned that there is an option to remove fibroids, does that then not hinder or in a way influence their chance of having children in the future? Can they successfully remove fibroids without having to worry about not being able to conceive?
Yes. A procedure can be done whereby the fibroids are just removed and the womb is still left in place. However, people need to be aware when you're going to have a procedure to remove your fibroids, you are warned by the doctors that when we do remove the fibroids, they tend to bleed a lot. If you bleed to such an extent that the bleeding cannot be controlled and your life is a danger, then the logical thing will be to save your life, and that means removing the womb instead of just removing the fibroids. So during the counseling process, it's something that you need to be warned about, that this is what would happen. However, it's never usually the first step that happens. So if you are young and you have fibroids, they can be removed successfully without jeopardizing your chances of having a baby. Then one thing that people need to know, when you've removed fibroids, it doesn't mean they will not come back. They do come back. All right.
Okay, and my next question has to do with fibroids, and then is moving into the contraceptives. So I also have another question where someone says they were diagnosed with fibroids, and the doctor then told them that in the interim, while they wait for the surgery, they might have to go onto contraceptive pills or the injection. What is the reason for that? Because earlier you just mentioned that people with fibroids must try and stay away from contraceptives.
Yes. Okay. When I said contraceptive, mainly the ones that contain estrogen, because it's contraceptives with estrogen, they feed the fibroids. Now, as doctors, we would advise someone with fibroids to go on either the injection or they will take the progesterone-only pill. Most of the time is to control the bleeding. Remember, when you take in the pill, you will bleed for a certain number of days and then the bleeding will stop. So people with fibroids, they tend to have prolonged bleeding. So when they go onto the pill, their bleeding will be controlled. Now, when we mention the pill, remember there are two types, the progesterone only or the mini pill, and there are many types whereby they've got both estrogen and progesterone. We tend not to advise the ones that contain both for people with fibroids. Okay. So it will mainly to regulate the bleeding, and sometimes you need to build the iron levels before you go for surgery. So we do that at times. And then for some people, there is an injection that can be used to shrink the fibroids. But now the tendency of that injection it brings about menopause. Menopause is that stage whereby you stop having your periods and people become irritable. So you can get that injection given to you now and again. The problem as well is that it brings about menopausal symptoms and it actually affects your bones. When I say it affects the bones, for some people, when they use that over a long time, they develop something called osteoporosis. That means their bones become thin. It's different for someone having arthritis, but they have something called osteoporosis, meaning that their bones are thin and they become thin and brittle and they can break without too much trauma. So we don't really like using that injection as well, but it can be used maybe in someone who's got big fibroids and you use that, you have only 2 injections and then you go for the operation to shrink them temporarily. Because when you use that injection and you stop, then the fibroids will grow back again.
Interesting indeed. My other question, as I mentioned earlier, that I was now moving from fibroids into contraceptives. In terms of contraceptives, many people use contraceptives while they are young. Does that then in any way influence their chances of having children in the future? So maybe an overdose and overusage of contraceptives at a young age, when it comes to maybe their 30s or whatever, and they want to have children, does it affect them in any way, or does it delay the process in any way?
Okay. When you are using contraceptive, let's say if you are using Depo, we know that Depo can delay you getting children up to a year, all right? Now, the pill, it doesn't delay you. The other methods of contraception, you remove them, then you should be able to fall pregnant immediately, unless there are other issues. So contraceptives on their own, they don't make you to have infertility. However, people that use contraceptive, they tend to not use the condoms. And then this is where problems could be arising from, because they could have other issues. They could have had infection that they were not aware of, which could be the one that jeopardizes your chances of having children. I'm saying they could have infection that they are not aware of. As women, you can get an infection and you don't have any symptoms, unlike the men. So as a woman, you'll be asked, have you ever had an infection? And you'd say no, and you'll be telling the truth. But when the doctor takes you to theater, they will find symptoms that there is scarring on the tubes, which means that you might have had infection that you were not aware of, which could be the one that affects your chances of having children. Okay.
All right. And with regards to women that have just had children and are breastfeeding, does breastfeeding then change a woman's menstrual cycle in any way? And after how long, normally after birth, can a woman expect their cycle to go back to normal?
Okay. Now, I'll start with your last question. After birth, you will have a bleeding that can last up to 6 weeks. It's heavy in the beginning, and then it starts being spotting. You might spot for up to 6 weeks after giving birth. That is normal. Now, once that has stopped, after 6 weeks, you should expect to have your periods. However, if you are breastfeeding, there is something that we call lactational amenorrhea. What that means is that because you are breastfeeding, you do not get your periods. The brain controls the hormones. They control the hormones that direct the milk, and at the same time, they control the hormone that directs the ovaries to function so that you can get your menstruation. So when that happens, when you are breastfeeding as a woman, the hormone that is the prolactin is the dominant hormone. And when you have high prolactin, remember earlier on when I was talking about menses, I had said that if you are producing milk and you are not breastfeeding, you haven't had a baby, then it means you've got a high hormone. So that's the same hormone that's produced when you are breastfeeding. That hormone, it does affect your menses. All right. Now, so we've talked about when your cycle will return, and then breastfeeding and the menstruation. What was the first question? Because I remember I started with the last one.
No, my first question was that but does breastfeeding change menstrual cycle in any way? But then you have answered that one.
Okay, all right.
Okay, those are the questions that we had, and there are no further questions. I must say this has been a very informative and interesting conversation. You know, it was a very, very interesting, and I learned a lot. I learned a lot as a woman myself. I really learned a lot. I think we learn new things about ourselves on a daily basis. And on behalf of everyone that's watching, I would just like to thank you for that. You know, it's really been a wealth of knowledge. And thank you. I don't know if you have any closing remarks for us, if there's anything you would like to say.
Okay. For me, what I would like to say is it's very sad sometimes when women come in when they want to have their children, and you discover that they haven't had menses, but they will only come in when they want to have their children. So as mothers, as aunts, as big sisters, we need to look out for the young girls and make sure that they do get their periods when they need to. If she's 16, hasn't had a period, please take that child to a healthcare provider. You can start at the clinic, you can go to your GP, you can go to a gynae, but someone needs to examine that girl. And secondly, women now, they tend to delay fertility for as long as they wish. Please, please, please freeze your eggs. Go and see your fertility specialist to talk about egg freezing. And the other thing that's been happening, we've been having young people being diagnosed with cancer. When you are diagnosed with cancer, it doesn't mean that you will not be able to have children. So before you embark on cancer treatment, please see your fertility specialist about fertility sparing options that are available for you. All right.
All right, noted. Thank you very much, Doc. I will now hand over back to Revnomba to do the closing for us. And yes, thank you so much.
Thank you.
Thank you very much, Doc, and thank you to our host, Sister Palisa, and thank you to the viewers at home for a really informative conversation. I think even us as men, as husbands, we have learned a lot, and we will be of great assistance to our partners and our spouses. So we thank you for this session. I know the time was not enough because there's more to the conversation, but we will make sure that we come again to this program to finish the conversation. So siyabulela kakhulu, uThixo makasigcinele wena akwandisele. First notices for tomorrow. Tomorrow we will be hosting Dr. Reverend Vume Dandala and Professor Bani Pichana. We will be doing a lecture ministry Katata Dandala. We'll have a couple of senior ministers and many people who knows Utatu Dandala. So please tune in tomorrow at 6 o'clock sharp on the lecture about Dandala. Come, let us pray and close. Now, Lord, we give everything to you, your glory, the power and dominion is yours. We thank you, Lord, for this conversation. We thank you, Lord, that every day we learn something new. And to others, Lord, it is a reminder of what they forgot. Dr. Singcu, for such wisdom that you gave unto her. And Lord, I pray that you will continue to extend her territory. Athi Nkosi izinto anazo umkhulisele umandisele ngaphezu kwezo abesele nazo. ekugqibeleni Nkosi uhlale nathi ukuthi sonke emakhayeni ethu usigcine usilondoloze lutho ufefele Nkosi yethu uYesu Kristu uthando lukaThixo nguyise umdlalo kaMoya Oyingcwele makuhlale baphumule kuthi sonke nasemakhayeni ethu sonke ukusukela ngoku kude bekunaphakade. Amen.
Amen, Mfundisi.
Thank you very much, everybody, and good night. Thank you. Thank you, guys.
Bye-bye.